Hi, so the first panel is about clinical and voluntary opportunities, and we have some amazing panelists. So the first panelist that I'd like to introduce is Jamie, and if Jamie wants to take it from here and give information about her organization.
Hi everyone, my name is Jamie and I'm the Public Information Officer for University of Arizona Emergency Medical Services, or UAEMS for short. Just a quick little summary about our organization. We are a 24/7 volunteer-based organization of student EMTs here at the University of Arizona campus, and we respond to 911 emergencies on campus and its surrounding areas.
Great. So the first question I'd like to ask you is, who is the best contact for students interested in volunteering for your organization?
That's a great question. I am actually the best person to contact for information regarding joining. You can send an email to our scheduling email, or you can also contact one of our chiefs as well. We are more than happy to provide information about getting involved or any other general questions that you may have about the organization itself. So I see a question about what role do volunteers have in your organization? So we are an organization comprised entirely of national and Arizona state certified EMTs. So with UAEMS, you will schedule or you will volunteer your time serving as an EMT to the University of Arizona campus. So whenever you sign up for shifts and work with UAEMS, you will be working in order to mitigate any 911 crises that may emerge while you are working. And then you also complete different trainings in order to keep up your EMT skills and make sure you are staying aware of the updated knowledge and different standing orders that this organization possesses.
Great. So I'm just going to go ahead and introduce the other panelists, and then we can take questions as it goes. So if Jody wants to explain her organization next.
Sure. I actually represent the Workship project at the Z Mansion, and it's a basic free medical clinic that it serves the homeless in the downtown area of Tucson. We also have a feeding project, which is on Thursdays and Sundays at 10:30 in the morning. But we have also taken up a soup supper every night at 7 p.m. with hot cocoa and usually grilled cheese sandwiches. And we rely on a lot of our pre-meds, pre-pharmacy, pre-nursing, anybody who wants to volunteer to come down and just help feed the homeless. But especially during Sundays and Thursday mornings, we have a basic clinic that we provide, like foot care, wound care, checking vital signs. And so it's a good introduction, especially for pre-meds and pre-nursing, to come in and get an opportunity to work with the homeless, see disparities that they face firsthand, and just kind of get that fear factor out of your system about touching people, talking with people. And there's so many misconceptions and preconceived notions about the homeless, and it's really not what you thought. And I was just as bad when I started 5 years ago. I was, very fearful of working with 200 homeless people. But you find out very quickly they're just like you and me, and any one of us could become homeless at any time. And so I think and especially for our pre-meds, it is an experience that schools are looking at. And I would say the last 5 years, most of my students have actually, especially in a traditional interview for med school, tell me more about this Workship project. And people be asking from different schools, would you be willing to start a project like this? And I saw a question that came up about COVID. During COVID, at the height from March 12th to August 31st, we actually had a tent city of our homeless that were either high risk or had COVID. And we actually had about 50 of the medical students, the third and fourth years, a few second years, that were coming in, and almost 24/7 we're taking care of our homeless to make sure that they didn't get any sicker. And there's also a big fear of the hospitals going in and being in a hospital and losing controls on the homeless participants' part. So it ended up being great because they were getting medical treatments, being seen by, we had DOs, we had PA students, we had many MD students from the U of A. Because their clinical rotations were canceled, they came to Workship and took care of the homeless.
Great, thank you, Jody. Now we're gonna introduce the next panelist, which is Dr. Alejandra.
Hello, good morning. It's amazing, 120 something students. Thank you for having me. This is amazing. I'm here representing the Office of Equity, Diversity and Inclusion at the Arizona Health Sciences. And I'm going to have the website here so you can go and browse and look for our programs. We have programs that goes from high school students that is more like career experience, a career exploration, all the way to we work with residents and faculty. So most of our programs are for free, and sometimes we offer stipends. So I've heard from some of the students that they're kind of afraid of maybe applying to programs or even looking for programs because maybe they don't have the means to cover. But here, all of our programs are tailored for you to make you a better applicant either for med school, pharmacy, public health, nursing. So I'm here to talk about the main programs for you, which is Spaces Conversantes, the Frontera Summer Internship, Medford 93, and do we have transfer students too, Anam or Rene?
So the transfer students are in the other session. However, we will have their contact info so we can send them information about our different programs. This is also being recorded. Yeah, so we'll make sure to share with them when we post it on our website.
Yeah, because for them, we have the Bridge program, and it's kind of similar program like the New Start program. So our students, they also have the clinical and research experiences. Some are at Banner, some are at the COP clinics that are run by the College of Medicine, and some with the mobile clinic run by the College of Public Health, and also Clinic Amistad. So I think maybe later on you're gonna start asking questions, but I'm sending you the links so you can go and learn more about our programs. But yeah, I'm gonna also send my email so you got a chance to send me your questions. That's me.
Thank you. And the next panelist that we have is Roger.
Here. Good morning, everyone. I don't see myself on there. Do you see me?
Yes, we can see you. We can see you and hear you.
All right, good. So my name's Roger Coates. I'm the volunteer coordinator at Medicis Hospice. Our office is located in Tucson, but we actually serve patients in Tucson, Green Valley, Sahuarita, on down into the Santa Cruz County. So right now we have about 60 patients on our rolls. And anyway, that's what we're doing is we're caring for people in the final days or weeks or months of their life. When COVID was not as strong and raging as it is right now, a lot of the volunteers' work was actually going into patients' homes and basically staying with them, giving them companionship. They would also go and stay with the patients when the caregivers needed to go grocery shopping or go to the bank, that sort of thing. So basically we had volunteers in homes, sometimes nursing homes, sometimes other facilities, just basically trying to give companionship and socialization to patients. Since COVID kind of ramped up, we've kind of shifted and we've pulled the volunteers back into the office as much as we could, just for their protection, but also for the protection of the patients and families. So right now we do have volunteers helping us with office duties, everything from helping with computer work to filing to organizing, perhaps helping with bereavement mailings, sometimes answering phones, that sort of thing. We have not completely stopped volunteer visits into homes, but they're we're very cautious about how it's done. We try to make sure that the patient and their families know that they really, really want it. And then number two, we try to make sure that the volunteer knows that what they're getting into, and that we certainly will try to protect them, and we won't send them into homes where we know there's COVID present. And we check on that before each and every visit, but we are going to try to protect the volunteers. Part of the thing that I wanted to try to share with students right now, if I could, I'm looking ahead, and I believe that we've had one of these, you've had one of these health information blasts like every November, at least the last 7 or 8 years. And I would encourage the students not to just totally back away and look the other way and not think of volunteering in a hospice for a whole nother year. And I say that for a few reasons. But one of the reasons is, hopefully when this vaccine gets up and rolling, maybe we'll see some good signs. We'll see some of the numbers begin to decrease. And I do think hospices will continue to place volunteers into homes, into nursing homes, and to facilities. So I just encourage the students not to completely disregard it for a whole nother year, because I think they may lose some opportunities that they may want or may like as they are on their quest toward their, whatever they're going into, medicine, nursing, pharmacy, etc. So when a volunteer comes to us, they go through an orientation program. We train them. We try to share with them what they're going to be finding and getting into homes. We try to support them in that way. And basically, we just try to take our time just to make sure that the volunteer is comfortable. Some of our volunteers, even though they live in Tucson, they have been willing to go all the way down, say, into Green Valley and visit with patients there. That sounds like a long way, but if you're on the freeway, it's really about a 30-minute drive. It's not too far off. But we have had some volunteer opportunities down there, and some of our college students have assisted us with those. So anyway, I think it's a good thing. I think one of the things that you'll find interesting with a hospice, and right now, believe it or not, there's probably about 23 hospices in the city of Tucson, or providing services in our city. Every single hospice has a volunteer coordinator. So they're not getting out of the business of volunteerism. I think things have slowed down. I think things have been more cautiously basically governed and watched over. But I think volunteering will certainly stay in the hospice framework. Believe it or not, volunteers are one of the care members on a team. If you look at the team of who's taking care of patients, basically it's made up of the doctor, the nurse, the home health aide, there's a social worker, there's a chaplain, a bereavement counselor, and a volunteer. So volunteers play a big role in basically helping to care for hospice patients. So I would just probably, I'll close my little speech here with just saying, you might want to just kind of maybe think of us again like in February. And I'm not saying don't get started till February, but in February, I think that they're rolling out the vaccine. I've heard in February, at least I've read in February, and just keep kind of checking in with us to see what it looks like as we go along. And volunteers, people who are interested in volunteering can certainly call me now and get started now, at least in terms of going through the orientation. And that way they would be up and ready for when it does open back up more fully. So happy to answer any questions when that time comes. So thank you for letting me be here again.
Yeah, thank you so much. So I'm just going to ask overall questions for all of the opportunities that you guys just described. So what do you guys look for in a potential volunteer, as well as how flexible are you in scheduling the time for volunteers?
Can any of us start
Yeah, just
talking?
anyone. Yes.
Oh, can you hear me?
Yes.
Okay. For Workship, all you have to do is come. There's no orientation. There's no application. You just come and you provide help to those that are less fortunate. Yeah, so it's pretty easy for at Workship. We're located downtown at 288 North Church Avenue. If you know where El Charro is downtown, we're across the parking lot, and it's a big blue house. It's actually a wedding venue. The house is owned by Pastor Tom Hill, and he is actually, Workship has been going on for 20 years, and he's the one who started it, and he took a vow of poverty. And so his congregation is the homeless. And we don't take money donations. We just take donated items, food, shoes, medical supplies, anything like that. The one thing I meant to mention earlier too is there is also another opportunity up in Phoenix, and it's called Andre's House, which is very, very similar to Workship, except for it's like on steroids. It's about 3 times as big as what we are. On Sundays, we average 200 to 300 homeless that show up. During the weekdays on Thursday, and then in the evenings, it's more like 50 to 80. So, but again, it's a good opportunity to really understand disparities and how to listen, how to talk to people. But again, it's just show up. That's all you have to do, and we'll put you to work.
Great, thank you. So Jamie or Roger, if you guys would like to answer the same thing about what do you guys look for in potential volunteers and how flexible are you in scheduling them?
Jamie, do you want to begin or do you want me to?
Either works for me.
Go ahead, you're talking, go for it.
Awesome. So we are currently looking for students either in undergraduate or graduate school who are currently EMT certified in order to join UAEMS. So in order to become EMT certified, you can take any accredited course at any local university, community college, or even a private institution. And a lot of these organizations are offering these certification classes over the winter session. So if you're not currently EMT certified and you do want to apply before our next application closes, which will be in January, you can take one of these courses at any of those institutions. Also, if you're not currently EMT certified, UAEMS is also offering a first responder scholarship. That's actually how I came to join UAEMS myself. Which is a scholarship that will actually pay for your EMT certification and will help cover the costs associated with those. So if you are not currently EMT certified, but you still want to join UAEMS and gain some real life clinical skills and see some real life emergencies, you can join through that process. And both of these processes and the applications can be found on our website, and I can send the link at the end of this session. So those are just kind of what qualities we're looking for in our volunteers. And then in terms of flexibility with scheduling our students, so we currently have a minimum hour requirement of 30 hours per month, and we have different shifts that you can sign up for. So you have an A shift, B shift, and C shift. So our A shift runs from 7 a.m. to 1 p.m. Our B shift runs from 1 p.m. to 7 p.m. And then our C shift is our overnight shift that runs from 7 p.m. to 7 a.m. So you can sign up for any of these shifts that work with you. We're really flexible regarding school schedule and any other conflicts that may arise, because we know this is a really difficult time for a lot of our students who are working with us. Yeah, and I think some general qualities that we are looking for in our volunteers is that we really just want students who are really driven to make a difference on the University of Arizona. And then we're also looking for students who can think in high pressure scenarios and keep a level head and make those really important decisions in a pre-hospital setting. And then we're also looking for students who are really oriented towards working in a team. Typically our crews consist of 4 different EMTs working together. So we really want students who are able to work cohesively as a unit in order to provide quality care to our patients on the University of Arizona campus. But yeah, I will be sending our email and the link to our website after this if there's any other questions as well.
Okay, for a Medicis Hospice, in terms of what we're looking for, basically we're looking for individuals that, I'm just going to say this in the nicest way I can, we're looking for people that we feel would be safe and comfortable and at ease around the patient. So you picture, here's a patient, and this poor patient has some advanced disease process going on, be it cancer or heart disease or lung disease or kidney disease. They don't feel real well. So we need to make sure we put somebody into that home that we can trust, that's going to be kind and nice, that's going to fit into what the patient needs to do. For example, I know in the past I have filled in when I could not get a volunteer to go out on an assignment. And I've gone into to be with 2 elderly gentlemen. And when I went into the homes of these elderly gentlemen, what they were doing, they were watching Westerns, old Westerns on TV. They really didn't want to talk to me. They didn't want to hear about my story. They wanted to finish watching their Westerns. So I just went in and sat with them on the couch. One was in the bed, and we just watched Westerns, or we watched TV for the period of time that I was there until the loved one came back or their caregiver came back. So we just need somebody that can kind of fit in comfortably, can go to this patient's home in the time period that the patient or their caregiver has asked for. I'm very flexible with our volunteers. I know that volunteering is a secondary thing for a student, especially students that are pursuing medical school or things like that. And I know that grades are your most important thing, I would say. Getting ready for your MCAT is mighty important. So I know that volunteering takes kind of a 3rd or 4th chair down the road, and I'm okay with that. And so there'll be times that I would call somebody, a volunteer, and say, we have a patient on the west side of town. They want somebody on Friday morning from 10 o'clock in the morning until 12 noon, say. Is that anything that would fit into your schedule? And the volunteer could look and say, not this week because I'm preparing for a test that I have that afternoon or something. So they can turn me down. That's okay. I would continue to offer them the assignments as I had them come up. Sometimes we're going to have a fit where the patient needs somebody, that volunteer can actually fit that need. And sometimes they just kind of get along well, and the patient is fortunate enough to live a little bit longer. And so we may send that volunteer back into that home on a weekly basis, every week, if the patient desires. And that's really nice because then there's a bond, there's a friendship, they get to know each other. They get to share about each other. We've had volunteers that have done that and gone down and had lunch together and just they get close. And so that works very nice. Sometimes that doesn't happen. Sometimes patients will actually pass away rather quickly. We don't always know when that's going to happen, but sometimes the volunteer can get going back on a weekly basis, and that's great. I don't require any type of thing like, okay, you got to give me 100 hours or you got to work for us for 2 years. I don't do that. It's kind of come in, hopefully this will work for you. And I do think it's a good experience and a good, just a good thing as you prepare your way trying to get into some of these, you know, be it pharmacy, medicine, etc. So I'm real flexible that way. So.
Thank you, Roger. I also wanted to get my Clinic Amistad hat, so I'm gonna share the link. And this is a free clinic in South Tucson, and we look for students committed to, it can be in any of the health careers. You're gonna get a great experience how a clinic runs, and you go through all the stations, front desk, work with taking vital signs. We encourage students that are bilingual, English and Spanish, but it doesn't, it's not a requirement. So there it is. You can go to the website and you can send your application, and it's a 1-year commitment. But if you're thinking on applying to medicine or any of the professional careers, you need to have a good amount of hours. So yeah, that's me. Thank you.
Thank you. And now we're going to head over to panel number 2. I just want to thank all the panelists for joining us today. And so I'll be passing it over to Kobe, Bridge, and Yaneli.